So in the interest of time, I think I'm going to get started, and I will start with the land acknowledgement. So we acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit Valley. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. Okay. So welcome everyone, and good afternoon. And thank you for taking the time to attend this webinar on successful paths to senior promotion from a mentorship lens. So the webinar is designed to be informative and interactive. I'm hoping it's useful, and I'm hoping you have opportunity to ask all of your questions. And also, I'm encouraging everyone to reflect as we go through this webinar, but also in the coming days. Is now the right time for you to move forward? Because it may or it may not be. And so I'm encouraging you to take some time to reflect on that. For those of you who don't know me, my name is Viola Anteo, and I am the mentorship lead. And I want to start off by thanking the panelists for taking the time to share their wisdom and their insights. So next slide, please. And before I introduce the panelists, I'd like each and every one of you to think about this Rumi quote, because I think it applies to going forward for senior promotion. It highlights it. So whoever enters the way without a guide will take 100 years to travel a 2-day journey. So that's a Rumi quote. And that's what I'm hoping these narratives from that our panelists are willing to share sort of helps you cut your journey down in terms of time and effort. So I want to thank Dr. Joyce Nyhoff-Young, Dr. Farhan Asser, and Dr. Harvey Blankenstein. Actually, Maddie, can you put up the slide with the pictures? Yeah. I want to thank them for really generously taking the time to talk about their insights. They've all been through senior promotion, and I'll get to their bios in a moment. But this is like such a gift of giving back. So thank you. I'd be remiss if I didn't remember to thank Maddie Morissetti, who is in the Office of DFCM Mentorship, and Sarah Latofsky, who is in the Office of Academic Promotions, both of whom you will probably get to know very well if you decide to go forward for senior promotion. But none of this, the webinar, the mentorship, the senior promotions process, none of this would be possible without their excellent support, administrative support. So thank you. Next slide. So I'm going to go through a quick flow of the session. I'm going to keep it brief. Each of our panelists are going to have an opportunity, 7 to 10 minutes, to review their senior promotion journey. And I'm hoping we can save the questions till all three have spoken. I'll then briefly go through the impact of mentorship. And Sarah and I will discuss specifically the DFCM senior promotion process. There's an internal process as well as one that's external. And I'm hoping this will encourage, the webinar will encourage you to reflect on your personal why. Like, why are you considering senior promotion? And is this the right time for you? We'll talk about supports and next steps within the DFCM, but also at your site. So without further ado, I'm going to introduce all three panel members first, and then Joyce will speak first. So Dr. Joyce Nyhoff-Young is a senior education scientist with a PhD in curriculum, teaching, and learning from OISE at the University of Toronto. She is an education scientist, medical educator, and professor in the Department of Family and Community Medicine. the Academics Program at Women's College Hospital, the DFCM Office of Education Scholarship, and the Family Health Teams of Women's College Hospital and Unity Health. She has 30 years of experience with qualitative and mixed methods and a research focus in participatory program development and evaluation. Under her mentorship, her diverse interdisciplinary teams have developed many educational programs, curriculums, and resources. The next speaker, and if we could show the picture, thank you, Maddie, will be Dr. Farhan Asra. Dr. Farhan Asra is an internationally recognized leader, physician, educator, academic, and researcher. He is trained in family medicine and public health and preventative medicine. In addition to his faculty appointment with DFCM, he is a cross-appointed with the Dalai Lama School of Public Health, a global faculty member with the International Space University in France, and a member of the Temerity Center for Artificial Intelligence Research and Education in Medicine. He also holds leadership positions with the Trillium Health Partners, being the physician research lead at 2 of the DFCM teaching hospitals at the Mississauga Hospital and Credit Valley Hospital, and is an investigator at the Institute for Better Health. Dr. Harvey Blankenstein. So Dr. Harvey Blankenstein is a comprehensive family physician at the North York General Hospital, where he has been teaching extensively at the clerkship and postgraduate levels for over 30 years. Dr. Blankenstein has been a previous North York General Hospital undergraduate program director and member of the Undergraduate Education Committee at DFCM. He also served as the interim undergraduate program director at the DFCM. These efforts have been recognized with several teaching awards, including Excellence in Course Program Development and Coordination. Dr. Blankenstein was one of the founding members of the Quality Improvement Program and the QI Curriculum Development Team at the DFCM, which delivered a new QI curriculum into the residency program and provided QI training to faculty. So without further ado, I want to welcome all 3 of our panelists. Thank them once again for generously sharing their journeys, and we will start with Joyce. And if anyone has any questions, please feel free to put them in the chat as we go.
Well, thank you for the opportunity to present here tonight. I'm presenting tonight from the Carrying Place Trail over in Weston along the Humber River, in recognition of we're all coming from different places for where we're speaking tonight. So as Viola noted, I'm an education scientist who was promoted to full professor in 2020. My prior promotion to associate occurred 12 years earlier in a different department altogether. I attended the early DFCM promotion workshops for 3 consecutive years before proceeding successfully. It was a long process for me. My overarching takeaway from that process is that it takes a village to raise a professor. And with that in mind, I'd like to discuss 4 take-home messages from my promotion journey. First of all, seeking mentorship, efficiently populating your CV and dossier, challenges I faced, and finally, the importance of guarding your mental health and your emotional well-being. So first of all, seeking mentorship. Recently promoted colleagues were very generous. They shared their encouragement, dossiers, and insights as I move forward. I also tapped into the experiences of senior mentors. For example, I don't enjoy politics very much. And as a senior executive, my departmental chief, Ruth Heisey, wisely shared her experiences on the inner workings of the decanal promotion committee and the politics of promotion. Ruth also astutely recognized that as a local educator, I was eligible for a waiver of external review from the dean. That was a promotion strategy I hadn't even considered before. And that single observation on her part successfully changed my whole promotion approach. My departmentally assigned mentors, my senior mentors, were also very helpful. David White, who was at that time the promotion committee chair, and June Carroll, my departmental mentor, were both very generous with their time and support. For example, in the last push, that busy time to submit my dossier, June read my statements, pointed out gaps, and provided advice. I also very fondly remember David's real delight when he got to inform me of my successful promotion effort. Mentors often help me most by asking questions. For example, in a meeting to review my evidence, one asked me a really simple question. Okay, how would you summarize your promotion story? What's the nugget from all this information? Well, I couldn't answer that one. I was so involved in data gathering that I lost sight of communicating the why behind what I was doing and the work that I did. And that simple question helped me to refocus and communicate my story more clearly. It's important to be aware that mentors can provide conflicting advice and sometimes less than correct advice. Be ready for that. Your job as the candidate is to sift through all the feedback and apply it to your unique situation. You know your work best. There's no one-size-fits-all promotion strategy and mentorship strategy. Just try to find engaged people who want to help you proceed and have the time to help you do so. Second, populate your CV and dossier early. After my first DFCM workshops, it took me over a year to organize my CV to meet current standards and to capture and organize the evidence of my recent activities. The DFCM promotion workshops helped make the dossier construction process more transparent for me. Mentorship and practical tips from faculty like Barbara Stubbs and later Viola were particularly valuable for me. Carefully reviewing dossier samples that are available via Sarah now for presentation ideas was particularly helpful, and I took an awful lot of notes because it triggered thinking in my brain. The electronic dossier templates from Marie Laverman and from Sarah were amazing resources. Looking back at my CV, I wish I had applied for more scholarly awards earlier. Award applications force you to promote yourself, organize your data, develop a career story, and ask for reference letters. And all those things are really important for promotion efforts. Unsuccessful nominations at low stakes, because they're awards, show you where your story has gaps and where you need more evidence. So be persistent. Happily, after promotion, you can continue to use that beautifully organized dossier to apply for more awards and for your annual performance reviews and your next promotion. I learned to always keep my CV up to date and ready to share, and also that constructing my career story in the dossier was very difficult. I write well, but it took a lot of reflection, creativity, and time to compile my dossier and the narratives. Challenges. A major challenge I faced was a lack of dedicated time for dossier production. Promotion is a major add-on to our regular work. First, I learned to take advantage of departmental supports to help me gather my teaching and consultation data. Thank you to Rachel for so much help. I also carefully protected my academic time, especially in the mornings. That's when I write the best. My lack of time was aggravated by a lack of administrative support. This delayed my application by a couple of years. Finally, on the advice of a recently promoted colleague, I hired a really talented administrator who was very experienced with constructing U of T promotion dossiers. Lori became my sounding board for testing ideas. She helped me clearly present my 5 best pieces of work and expertly formatted everything while keeping us tightly scheduled. The significant cost was well worth the effort, and in future, I hope that now DFCM is subsidizing or considering subsidizing this type of major expense. Finally, guarding your emotional health and well-being. Applying for promotion involves making yourself vulnerable. We put our careers work out there for assessment and potential rejection by people we don't even know. It's labor-intensive, anxiety-inducing, and a high-stress process that heavily impacted my own work-life balance. So be careful to get the care, support, sleep, and exercise that you need. Also, be sure to discuss with your family, your loved ones, what your effort will mean for all of you. Before I began, my husband, Tom, asked me one simple question: why do you want to do this? And that was an important one for me. Make sure that promotion is something that you want to do that will aid in your own development and growth, not simply a departmental hoop that you have to get through. It'll make it a lot more fun and interesting. When I began the promotion process, I wasn't aware of how much family encouragement and patience were required, not to mention spousal proofreading. My family was my most effective support system, and promotion took a lot of effort from all of us. So In summary, when I started, I wish that I had known how early you need to begin thinking about the promotion process and how incredibly detailed, creative, time-consuming, and ultimately personally and professionally rewarding it is. It is worth the effort. In my experience, it does take a village to raise a professor. The promotion process works best when our amazing work as faculty, as well as our mutual caring and support for each other, are coupled with strong departmental cultures of mentorship and formal mentorship structures for promotion. The DFCM is increasingly good as a department from which to seek promotion. To encourage more faculty to move forward, I believe that more central changes are needed, especially to engage clinicians in that central process. How might we better, as a university, reward the collaboration, mutual support, and shared responsibilities that so many of us excel at? One strategy is to investigate how traditional performance metrics, attitudes, and politics within the decanal promotions committee itself may disadvantage minority faculty and clinicians. As faculty, I believe we are individually and collectively shining examples of clinicians, educators, researchers, and administrators, and our diverse activities, leadership styles, and collaborative alternative ways of succeeding are increasingly being recognized by the decanal promotion committee. I hope that this reflection on my lessons learned and my adventures will help both the department and you as faculty towards success in your promotion journeys. And thank you so much for your attention and best wishes for success.
So thank you so much, Joyce, for synthesizing those nuggets of wisdom. And I think if anyone, I would encourage, if anyone has any questions specific for Joyce, please put them in the chat, and we'll get to them after all the panelists have spoken. I'm now going to turn it over to Farhan.
All right. Thank you very much. Hi, everyone. And thank you, Viola, for that really nice introduction. And I just want to say that, yeah, I completely echo whatever recommendations that Joyce has brought up. And thank you for that as well. So I've just kept it really informal, just kind of giving a bit of my background, my experiences, as well as just some, I would say, suggestions, thoughts that I've just kind of experienced and then thought that this would be something helpful for others to know. Definitely, I would say that the aspect of senior promotion encouraging can be sometimes a challenge. Obviously, it's a daunting task. I do come in from a community-based teaching hospitals with the Children Health Partners. So often, even when I speak with faculty members, it's sometimes even a hard sell where they kind of go like, how is this actually going to benefit us? Interestingly, one thing that I kind of found was pretty much no one in my entire 2 hospitals here, Trillium Health Partners, kind of had gone through this process. And apart from a very experienced senior faculty member that we had from DFCM, there was no senior faculty member around from the DFCM at both THP sites. So that was quite a unique and interesting experience for myself. So it is something I think even the leadership is something that I would just suggest would be something to explore in those regards, just trying to focus it from there. Personally, I would say that I think the approaches for senior promotion was, I just kind of look at it as the natural progression of my career. Obviously, looking into individuals, especially if they might be interested in more, let's say, senior administrative leadership positions, I do see that a number of opportunities and doors open up for them. There have been over the years whenever I get those emails and opportunities. So whenever you see some really senior academic or administrative level, they always kind of even mention has to be associate or eligible for associate or full professorship. So those were one of the reasonings from there. Just before I kind of go, I can just a bit of a background. So I am working as a practicing family physician based in Mississauga, but also I've always had that interest in teaching and research. And I've just been kind of keeping all of those processes going, including overseeing a number of research opportunities and clinical opportunities with the THP, but also exploring and involved in a number of educational opportunities that have come up with the DFCM. as well. So it's just kind of combining a number of those opportunities together. One other thing that I would just kind of bring here, which might actually just increase the hopes to a lot of individuals here, I would say is that I guess my promotion experience might be one of those feel-good options, because what I kind of went through was I actually didn't look into the research, the promotion experience, like for a number of years. I even recall like my entire process. So probably the year before I had actually applied, I just kind of heard about it and I was like, okay, let me see, where is the application process to apply for the promotion? And I happened to email DFCM promotions, and they kind of clarified that, oh, the process is well into it already, and that cycle's already started, and it's not just basically filled out this form, send in your CV, and we'll look into that. So that was when I first kind of went like, okay, this is a little bit much more than I had looked into. But eventually, just the interest and commitment was there. So putting that time into it, I was basically able to explore and get to know much more about the process. Dr. White and Sarah has been really amazing. I've just been daunting them with like emails and questions. So definitely that was a big help across all the way as well. Basically, I would say just the other feel-good option. So as I just kind of mentioned, literally anytime I'm speaking to someone, they might go like, yeah, it might be really challenging for you to look into this, because literally no one around me had applied for a senior faculty promotion. So there was, and even interestingly, I wasn't aware, but it was even like everybody in my primary care leadership circles were actually at the lecturer or assistant levels. So it was something where, who do I ask? Who do I talk to? Is there anybody who's kind of gone through this process? So even that tended to be something quite like, I don't know what I should do here. And then just even in terms of one other aspect, which is kind of a not so common aspect, but I actually was one of the few individuals who I didn't end up hiring like an administrator or an editor. So I literally did the application process myself. Not that I would say that that's something that I would recommend to everyone. And interestingly, it was just like, it just goes to show that, yeah, if you put your heart into it, you do have some sort of experience, you can still get through that process and be successful. So yeah, that's just kind of my encouragements, that don't push yourself back or think that I don't think I'm ready. I would just definitely encourage yourself to look into it and push yourself. Now a couple of so that was basically my whole spiel from there. I've just kind of put up some quick thoughts that just my whole experience kind of went to, and I'll just try to then keep it pretty short after that, and I'm really open to more specific questions someone may have. So generally, I've always heard that question, that should I apply? I'm not sure if I'm ready. I personally would encourage everybody to just go ahead and try and go through that process. The reason why I would just say that is simply because I think getting to know that process, even learning that whole process itself, there was a lot of things that I just wasn't aware of. So if you put yourself into it, you just even start looking into that process, then you would realize, okay, this is a specific timeline. This is the work that I may require. And again, not to basically put more tasks on the DFCM promotions committee and stuff, but they were extremely helpful in just giving even insight with that whole stages where they assess your application. They kind of go through this. So even that, I would say, has been extremely helpful. Other faculty members who've had years more experience than myself, even when I was speaking to them, they found it helpful where like Dr. White and the other team, they went over the applications. Then they kind of went that, yeah, I think you might need more, let's say, emphasis on certain publications and certain areas. So it really kind of gives you that assessment or just the insight even about your career itself right now. Like, this is what academia is looking for. Are interested in academia, should you explore more publications? So not only from a view, but these are obviously leaders at a university leading a department. So these are their expectations of leaders within their own department. So it really kind of gives you even a glimpse into that, okay, this is where my career should be going or what I should be looking into. Additionally, I would just say that it's just so really helpful that it kind of just gives you that assessment, especially even from a community teaching hospital side. You may not get that experience in terms of someone's looking in through, let's say, your CVs, looking through the different roles that you've kind of gone through. So it really helps even giving an insight to your own career and the opportunities that you've taken up. So by all means, I would encourage people to look into that as well. One other aspect I should just kind of mention was, and I believe Joyce also brought this up, is, and I can't really emphasize enough about the CV component. So by all means, I would just say, I can't stress enough, keep your CVs updated. It was just one of the reasons I know individuals who haven't updated their CV for years, and it's literally you're gathering things at the last minute. And even interesting myself, like when I was kind of going through this, I was started going like, oh, wait, I did give this lecture. I was invited here. I could put that in. So it's just really small things that you tend to, like you might miss, which could be something relevant for your application, whether you've been invited for a talk, whether you've, let's say, participated in a publication, or even an academic half day that you led. All of these things are something that you might not realize then and there to put in your CV. And if you don't, you might miss out on that. So by all means, do that. I think once I was promoted to associate, I've actually made a specific folder, even my email. And then every time I get any kind of a invite to any kind of a talk, any presentation, I'm just storing everything in that email so that I could just keep my CV updated on a quite regular basis. So I definitely can't emphasize just keeping those things updated. And then just a couple of things which I'll just kind of wrap up on. Definitely one thing that I would say is a common myth, and especially that I had heard about from the community teaching sites, was that the downtown hospitals have it all. They have administrators that can immediately start helping you. You have, I don't know, what help. There was one faculty member who went like, oh yeah, I would have applied 3 years ago. I just don't have the time. I'm sure the St. Mike's have like 2-3 administrators helping them. But the reality is no one has any administrators doing that job. You're responsible for it, and or you're responsible finding someone to help you through that process, whether that's an editor, whether that's kind of an administrator who go through that process. So by all means, it just encourages you to kind of look into it. And then just the two things that I'll just kind of wrap up here, though, was by all means, I would just even encourage just to let people know that even that promotion cycle, it kind of resets every time you have to go to that other process. So anything that you've done as an assistant, once you've been promoted to associate at professor level, they look at what have you done after that. And the reason I emphasize this is I've had even colleagues who have been for the last 13 to 14 years have remained as a lecturer. And I've been kind of telling them that, you know, every position that you're taking up, it won't count the next time you're looking into something. So why don't you get promoted and then quickly start focusing on your next level? And this would all help for that. Whether you want to pursue it or not, at least you have that opportunity. And then just lastly, I just want to kind of wrap up with the focus on like mentorship that was here. So by all means, I can't emphasize how important mentorship is. And it's been extremely crucial at several aspects. Yeah, like I said, like I've been really appreciative to Dr. White, Sarah, the DFCM promotions committee. They've been really helpful answering questions, all kinds of small questions I would have. I mean, they were the only people to go to. I even recall like once I'd asked them, okay, who do I ask for advice? And they basically said, why don't you talk to your faculty development support at your department, in your hospital? The moment I went to ask them, they went, my main advice is go talk to the DFCM promotions committee, just because no one had gone through that promotions process themselves. So by all means, it's ask everyone, talk to everyone. Even after my initial assessment, Dr. White was extremely helpful, and I'm quite appreciative of that. Dr. Ross Upshur was also assigned to me later, so that's what they tend to do when they assign you someone. I have that public health and family medicine background, just like Dr. Upshur, so that was really helpful in getting his insight, his experience. And definitely, I would say even in those cases where I didn't have anyone, I was just reaching out to everybody I could. This is where your DFCM extended family of all sites really come in handy. I would say Dr. Stu Murdoch, Fakhan Young, Dr. Alison Maribom were extremely helpful. I would just ask them all kinds of questions. They would be really supportive. It is a daunting and really, I would say, cumbersome task. So they've been even supportive and encouraging. So these mentorship aspects is really just to even help you through that process has been really helpful. Additionally, I would say even Dr. Alison Maribom was actually someone who was the first person that I'd heard that who had gone through the application process without an editor and administrator. So that was yet again, it was quite encouraging to myself, where I was like, okay, someone's been through this. I do have a shot to do that. And so it really kind of even encouraged me. So it's really helpful. Their experience and expertise has been really helpful, as well as it's really supporting and encouraging you entirely all the way. So I would definitely even encourage finding someone, ask everyone questions, see whose interests and experiences aligns to yourself, and then just keep on reaching out to them. Everyone's been really helpful, and that's been really like a positive experience for myself. So thank you for this, and I just look forward to any questions you may have.
So thank you, Farhan, and for sort of clearly describing the challenges that you faced at a community site, and congratulations for being one of the first to sort of break that barrier and get through. And I hope you sort of give back to the ones sort of coming up. It sounds like you're already doing that. What I would say to that comment is we're very fortunate at the DFCM. Danielle Martin is our new chair, but even our previous chairs, like they are aware of these struggles, and hence have created like the central supports. I mean, we have a gold mine in Sarah Latovsky. I'm not sure every department has that. And actually our internal process is very rigorous compared to other departments. So you know that if you get through the internal kind of stages, you're well set to sort of go forward to U of T to sort of put your work out there in the world. So I don't want people to be discouraged. I do want people to think about their site supports and their central supports and where they would go to for each. What I will say is if your FD lead is at assistant, they may not have enough knowledge to help you get to the associate, or if they're at lecturer, they may not have enough. They may know some resources and they may be able to get you connected. But that's where, you know, Maddie and Sarah and I can sort of come in and help you navigate that a little bit. So I will now turn it to Harvey to share his journey. So thank you, Farhan.
Yeah, thank you, Joyce and Farhan. It was interesting to hear the common themes and that we shared some of the same journey, but I will probably echo a lot of the same that you guys have already mentioned. But I think it's sort of important to hear them again because some of those challenges and the work that you have to put in will continue for everyone. So. Just to let you know that I'm a family physician, a community family physician at North York General. We do have a very established family medicine department, David White being one of our former chiefs. So that was quite helpful. And David's been a longtime mentor of mine, as has Risa Freeman and some others and Val Rackless at North York General. But it was really my faculty development lead that sort of approached me about 2 years ago and said, you've been teaching for a while and you've never really applied for academic promotion. And my name had been mentioned within the department that maybe that would be something I'd be interested in. She tried to reassure me it wouldn't be a make-work project. It would open up new doors. It was great for relationship building. She heard so much about my teaching experience. So she was very, very supportive and encouraging. And then I felt, you know, it was an opportunity. It was a culmination for me from my commitment to teaching over the years. So she sort of struck a chord with me and got me thinking about the process. I found that a lot of my teaching led to leadership roles, either at the hospital or in the DFCM, and administrative roles as well. And that actually spoke volumes in terms of credibility and respect among my peers. And I mention these just because when I went through the process, especially with someone like David White and Alison Merbaum, like the internal process, they acknowledged a lot of the work that I had done. because we're very humble and don't really realize the collective accomplishments that we've achieved. So they were very, very helpful in making me realize that, and also in how to promote myself in the application process. And I also had 2 or 3 former students that sort of came up to me informally in the hallway and said, Alison Merbaum was one of my colleagues that actually was successful in getting her senior promotion. And then some of my colleagues came up to me and going, how come you've never applied? How come you've never done that? And they got me thinking. And it was really, it took me 25 years of pre-contemplation to get to contemplation and action, actually. And I knew that it was this juncture in my career that it was either now or never. And I was at the point in my career where it was a really, really helpful process to self-reflect and think about the next chapter, which is probably going to be my final chapter in my career. So it was really, really helpful for me to go through this whole process, just to make meaning out of my career plans and my progress to date. The other thing is I started to contemplate during the COVID, when we started to pivot and we're working remotely, and I thought that maybe I would have more time. I was home. That would afford me more opportunity. I was probably wrong, because I ended up being busier than ever. But it was at one of the COVID vaccine clinics where I bumped into Debbie Ellman, who's a colleague of mine, and I just spoke to her about the application process, what it was like. And she turned to me and she said, "You haven't done it yet? Where have you been?" So she was actually very encouraging and got me to think about it and move me forward. I applied for the Sustained Excellence in Teaching, not through the CPA, the Creative Professional Activity role. And I applied and asked for a waiver for external review. And I saw in the chat that people have been asking how you do that. It's actually a letter to the chair of the promotions committee and the chair of our department asking for external waiver. So don't get intimidated by thinking that you may have to do an external review, and there'll be external people outside of our university that will be reviewing your application. That doesn't necessarily need to be the case. I was also told that I had over 25 years of consistent high TES scores at all levels of teaching, both undergraduate, postgraduate, and interprofessional health professionals. It was pointed out to me that I was intimately involved in curriculum development and some scholarly activity that had significant output and impact. Viola mentioned that I was one of the founding members of the QI program committee, and until I went through this process, didn't realize what kind of impact that committee really had on inculcating quality improvement in our department. Farhan mentioned also, keep track of all your invitations to present faculty development at workshops, any mentoring that you've done, all those kind of things, which I did not keep track of for 25. I was not very organized over the 25 years. Your suggestion of having a folder and just keep putting all those emails in is golden. I had a lot of support and mentorship to get me through this journey. I was really inspired by David White. The interviews and the first level of discussion with David was very, very helpful, because he made me realize that he made me feel that I could very well be successful if I went through the process. And he highlighted the accomplishments and the capacity that we built at North York General and at the DFCM. Then David Eisen, who was our chief, recommended administrative support, but he was also moral support for me. I would call him while he was driving up to the cottage, and he would spend that 45-minute drive telling me, just do it, you'll get there, don't worry, you'll go through 3 iterations, 4 iterations, you'll get it done, it'll work. And he got me through it. Sarah Latovsky was more than just administrative support. She was morale support every step of the way. I also did hire an administrative support, Melissa, who I could not have done this without. I have to admit that. And I see in the chat somebody asked, how do you find that administrative support? Sarah will help you with that. There is sort of a cadre of administrative people that will help if you want and are willing to get some financial support for. The other thing is along the way, the letters of references that I obtained and the letter of thanks that I got from some of my former students were really, really supportive and encouraged me to do the application. I found it really, really humbling. What's required to get through this process? For me, it was at least a 2-year journey. I started in the middle of COVID, and I actually stopped after I spoke with David White, just because, like Farhan had mentioned and Joyce had mentioned, it took me quite a while to format my CV, update my CV and my teaching dossier in the format that they wanted. So I needed the time, actually, and I didn't think it was a race, and didn't want to rush through it. I would recommend you collate your material. As Farhan pointed out, I literally went into my shoebox of paper evaluations and paper references and had to scan them and organize them and categorize them. 25 years worth. But I'm telling you the story because if I could do it, anyone can. I wouldn't recommend putting it off for 25 years either, as Farhan had mentioned. The application process, people like David White and Sarah, they will tell you if you're ready to move forward, and if not, they'll tell you what you will need to fill the gaps, to carry on in the journey, because you've done a lot of the work already. I literally got a folder from my North York General Department of Family Practice. It was probably about this thick, of all my paper evaluations from seminars and workshops that I had done 20 years ago. And then there was a whole period where there was a gap in some of my teaching scores, because we went from paper to electronic evaluations, and I was missing some there and had to explain that gap as well in my application process. The other pearl I would recommend is you're going to need to dedicate the time. And I heard that over and over again from some of my mentors and some people who were successful before, is that they would dedicate, an afternoon a week or get protected time. I know that someone like Rick Pensner told me he was adamant he was not going to spend his summer doing it, so pushed himself throughout the year to really get it done. It takes a lot of discipline, but it's doable. It's really doable. And I'm glad I did it. It's really been the culmination and made meaning of my academic career for me. So I'm glad there were people like David White and Sarah who encouraged me along the way.
So thank you, Harvey. And I think like that's so important in terms of the why, like the culmination of all of your contributions. And I think all of us are making those contributions at some level. And it's just thinking about, yes, like what does that mean? And so I think promotions, if this is something you're interested in, is a way of the university sort of acknowledging all of the contributions you've made to the academic mandate and to learners. So it has meaning. So thank you for sharing your stories. I know that there are questions in the chat, and I think Sarah's going to come to the waiver of external review in just a little bit. And she's also talked a little bit about DAC and accounting for diversity, inclusion, equity and inclusion in the promotions manual. But Joyce, I was wondering, since it was sort of part of your narrative, if you had anything specific you wanted to add to that question.
About specifically the teaching waiver?
Yeah, no, about the accounting for DEI issues in politics.
So in terms of equity and diversity and those kind of issues, I really do believe that the system was set up from the get-go for a different time and place.
Mm-hmm.
And the traditional metrics of publications, research papers, that kind of thing, curriculum development, while really important because they are a good indicator or metric, there are so many other things we do within the department. We do community work, we do community support, we do program development in healthcare. You might be doing policy work with the government. All that, while you think it's something apart from the university specifically, is really important material that we're doing that needs to be recognized. And I don't do policy work, I don't do government work, but I have so much respect for people who work at that level because it's so crucial to making the stuff that I do at the grassroots level work. Mm-hmm. And so don't forget certain areas of what you're doing because they are all very important and they are non-traditional metrics that are being increasingly recognized.
And I just want to support that, Joyce, by saying, more and more they're recognizing creative professional activity. So a lot of what you talked about is sort of embedded in that, but they're also recognizing sustained excellence in teaching. And this is where the waiver comes in. And what the waiver means is you don't have to show national impact. It can be, your clinical teaching and you've been a fabulous teacher and, the university wants to acknowledge you for that. So I'm going to go on to the slides and we can discuss this a little bit more. If people have questions, please put them up in the chat. But I'm going to sort of leverage off what you've been saying in terms of what we're doing and what is the potential impact of mentorship. So why are we talking about mentorship? Well, really, the literature does show that mentorship can have an impact in terms of your clinical work, your teaching, your scholarly work, just even your wellness and what leadership roles you decide to take on. So there was a study on the potential impact of mentorship, and the study was conducted in the Department of Medicine at the Massachusetts General Hospital. And what the authors concluded is that faculty who received high quality, and I phrase that, high quality mentorship, expressed increased job satisfaction, so less burnout, and there was a decreased likelihood that they would be stalled in rank. And so it is that person sort of encouraging you to reflect on, you've done so much, do you want to go forward? This is how you can do it. These might be some of the barriers. Start collecting your stuff. So really that's what we're hoping mentorship sort of provides for you. So from now, next slide. So I want you to think about keeping it simple. You've heard it takes time. You've heard it, you may need to hire someone. You've heard it takes a number of kicks at the can. Joyce said 3, I think Farhan sort of alluded to having to start at the right time. And Harvey, you talked about really thinking about this longitudinally. It's not going to be sort of done necessarily in a month, but keep it simple. So from now until January, I want you to think about, do you understand the senior promotion? Do you understand what's required? And do you understand the timeline? And now in moving forward, just think about your personal why. Because once you know why this is important to you, then it won't seem like a make work project when it comes to the actual collating and nitty gritty. So I encourage you to keep it simple, ease into it, and understand the process. So the timeline at the bottom is designed to help you think about the process. And so from September to January, just think about getting ready. And this is where DFCM Mentorship and Maddie and I can help you by either connecting you with a mentor that is not part of the official senior promotion process, but just to help you sort of brainstorm around, is now the right time for you? From January to April, and I apologize, the new chair of the Senior Promotions Committee is Jeff Kwong. So David White has retired. But from January to April, Sarah Latofsky and Allison Meerbaum and Jeff Kwong will be running formal senior promotion workshops. And those are 3 workshops designed to help you work through the process, like the pre-application process, the packaging of your dossier, all of that. Sarah would be able to answer questions or give you advice on. Your pre-application will be due at some point April 2024. And so that application gets submitted to a senior promotion committee, and I think there are about 15 of us, correct me if I'm wrong, Sarah, 15 of us on that senior promotion committee, and we get assigned a package to review and then determine if there's enough material there for the candidate to move forward. And so if the decision is made that there's enough and that you can move forward, you then are encouraged, you get assigned a mentor, and from May to September, you work on like creating your senior promotions package. That gets submitted to Sarah in September, and it still goes through a little bit of an internal process where we send these dossiers out to be reviewed by external reviewers, and then eventually in January, that's when it gets submitted to the decanal committee, and then they review it. So keep in mind, if you start this process with the pre-application in April 2024, you will not know until June of 2025 is when you will receive your promotion if it's successful. So there is an internal process and there is an external process. Sarah, I don't know, do you want to add anything to what I just said?
Yeah, I just want to very quickly touch on 2 aspects because I know we only have a couple minutes left. One is the process, and I know others have sort of said it can seem daunting, and it really can. You know, from start to finish, it's kind of like 1.5 years because we start with the workshops in January, and then promotions aren't approved until the July of the following year. But the reason we have so many steps is for you as candidates to ensure your success, because there are a lot of departments in the Faculty of Medicine that don't have this sort of rigorous process, and faculty can kind of just submit whatever they want, and the success rate is much lower. So the reason we have a pre-application is so the committee can give you this amazing feedback, and you can take that and build upon it and build out your final dossier. So we have an excellent success rate, and that's really because of this vigorous process that our department has built up. I also want to touch briefly about eligibility. So, you know, it's important for you to know that to apply for associate professor, you have to be able to demonstrate national impact and reputation. And if you're going to apply for full professor, you have to be able to demonstrate international impact and reputation. So that's kind of really the criteria that when you're meeting with your chief or you're meeting with Dr. Kwong and you're coming to the workshops, keep that in mind. Now, there is this pathway that we've been touching on before called waiver of external review. And this is for folks who are really like their core teachers. And that is kind of the focus of their career. And they've been teaching, in a sustained way for 10 years or 15 years. And you have excellent scores, you've been mentoring students, and that's kind of the focus of your career. For those folks, because the nature of teaching is local and sometimes regional, you don't necessarily have to demonstrate national or international impact. So that's what the waiver of review, external review, is for. And basically what that happens is you'll submit your promotion package like everyone else, and it will only include teaching. It won't include like CPA or research or the other buckets. And your dossier won't be reviewed by external referees in other parts of Canada or the United States. It'll only be reviewed by reviewers at U of T who can speak to your local impact. So that's what the waiver of external review is. And that's something that you would speak to your chief and Dr. Kwong about to see if that's something that you're eligible for and that you should pursue. And also just say, in order to get started, keep an eye out for the dates for our senior promotion workshops. They will begin in January, and we'll probably send out an email via listserv and on the website around those dates in the next month or so. So just keep an eye out for that, and at least come to the first workshop, because you'll get a lot more detailed information about the process. And like other people have recommended, start your CV and your teaching dossier. Like those two things are the core of your foundation. And if you already have those locked in, it's going to make everything so much easier for yourself. And, start collecting all your documents, any letters that you've gotten, inviting you to a conference, or thank you notes from students. All that stuff is great and will serve you well if you kind of have built that up when you come to the table. And you can always email me if you have any questions.
Thank you. Thank you, Sarah, for sort of synthesizing that. And so I'm going to add this to the next slide. So from now till when those senior promotion workshops actually start, for those of you who don't have your CV in order, don't have, are still not sure about the process, I encourage you to sort of reach out. And I'd like you to think about this process in terms of 3 buckets. Obviously, the why, and that is some personal reflection you have to do. And then the what and the how is what this slide sort of refers to. So I think the 3 buckets are: what's the work you've done? How do you package it? Does it meet the bar? A support from a mentor to help you brainstorm some of those questions. It might really help you either say, yes, I'm ready, I should have been sort of doing this 5 years ago, or no, maybe if I finished this project, then I'll be sort of better aligned to move my package forward and go forward for senior promotion. So the first bucket is the thinker, and that's what your mentor can provide you with support. And I sort of harken back to Joyce's narrative, where it's not like, ultimately it's you that will decide how to package things, what to do, how to put it forward, and different mentors can give you slightly different advice, but it really is a support to actually just have someone there to brainstorm around, how did you do this, how long did it take, what can help me. The second bucket is the feet to the fire. And this is where I think once you've decided you want to move forward, having a peer mentor or a buddy can really hold you accountable to that process, because it is easy to sort of not set aside time, be very tired at the end of the day, have competing priorities. And unfortunately, I think we all are more accountable to others sometimes than we are to ourselves. So having a buddy that you go through this process with can be really motivating and really helpful. So think about that. And we will be offering a group mentorship sort of program process after this. So you'll get an invitation to see if you're interested in that. And the third bucket is the chaos. I call it the chaos because it really is getting organized, collating your material, doing your data summary sheets. And that is really where some administrative support may be very, very helpful. There are people who've done it on their own. I did. It sounds like Allison did. Farhan did. But sometimes if you can get some dedicated support with that, it does save time and sort of angst. So next slide. So think of it in terms of a team. You can't do this alone. You have a team at your site, and that's your chief. And you should always, if you're thinking about promotion, always have a discussion with your chief, because your chief needs to be on board and say, yes, I think you're ready to go forward. You also have your FD lead who can direct you, either either knows of the senior promotion process or knows how to connect you or get your questions answered. And then colleagues and administrative support. So Farhan, I think, alluded to this, to really think broadly about who can you go to, who can you ask. And then you've got a central team, and that's DFCM Mentorship and DFCM Promotions. We're here to, help you think about this and support you along the way. And so next steps, focus on your personal why. If you have questions or you're looking for mentorship, please email DFCM Mentorship. If you're ready to go, think about contacting Sarah at DFCM Promotions, and consider joining the peer mentor cohort that you'll get an evaluation and also an invite to join that group. And then there are resources that when you're ready, when you know your why, then you go to the Faculty Promotions Manual and spend some time reading that, because it will trigger many questions, and ultimately that's the guide that you need to follow. So the resources are listed in the next slide, and we will actually be sending everyone who attended here, will be sending them out, I believe, a package or the listed resources. There's some further reading recommended if you want to know more. And I want to thank everyone for taking the time to actually join us today and for sharing their journeys, and Maddie and Sarah for providing the support. I don't see any more questions in the chat or in the Q&A. So I think I'm going to give back 15 minutes of people's time, or actually 20 minutes of people's time. But if anyone has questions, or I don't know, Harvey, Farhan, Joyce, if you have any last thoughts to leave people with. No? We're good?
I just want to say one kind of peppery thing. I think Harvey alluded to this too, is that it was amazing to me how each step of promotion built up my confidence in what I was doing, because other people external to us are recognizing the value, the worth, and the excitement of what we're doing. So it really has an added benefit of making your credibility stronger and your reputation grow. And I found that very helpful and very supportive.
Yeah, and I'll add too, when you put together your dossier, you'll solicit colleague letters of reference to put in your dossier, in different areas, around your teaching and stuff like that. And I think you'll be very overwhelmed and humbled by the letters that some of these people write for you. Like, sometimes it's very touching for me to read through these dossiers and read, letters from colleagues saying this person has changed, the field of this, or their work has impacted so many lives. And I think to go through this process just to even read those letters is really worth it.
And I can just add that, yeah, definitely echoing all of these experiences as well. And even I think on a personal level, it's like the entire process itself, it just really helped me grow as in terms of my career itself. You kind of get to know what you've been done, not only the acknowledgement part, but it's just kind of going through this entire process of even updating your CVs and all of those aspects. It's been really helpful. And even now, like if there's something quite confidently coming along, like a position or some leadership opportunity, I really have a really nicely done CV ready to go. So it's really helping you even at a professional development level as well.
I'm gonna say thank you, Harvey, Joyce, and Farhan, Sarah, and Maddie. This is always, it is a labor of love. I encourage people who want to go forward to reach out. There's support. And I will say on October 26th, the senior promotion group mentorship will be launched. So don't worry if you miss it, but just putting it out there that if anyone is interested, please reach out to us. Have a safe evening.